talk about IBS just a minute, which is irritable bowel syndrome. That is a functional motility problem of the colon that is diagnosed without evidence of an organic disease. In other words, when we see our patients, sometimes it can mimic other diseases such as inflammatory bowel disease, so we have to rule out other causes so that we know this is irritable bowel syndrome and not some other organic problem. Now, the foods that trigger this have previously been thought of as fatty foods, caffeine, alcohol, and sometimes fibrous foods such as insoluble fibers such as wheat and things like that. Now in this day and age, we know more about FODMAPs, low FODMAP diet, and that's the newest thing about concerning irritable bowel syndrome. That is called fermented oligosaccharides, disaccharides, monosaccharides, and polyols. Now, you ask, what is that? And I understand that it can be very complicated. But when you look at that, those are short-chain carbohydrates that are incompletely digested in the small bowel. And then they can pass into the colon, just partially digested. And when they do that, they're osmotic, meaning they draw water into the colon, which can cause crampy abdominal pain, bloating, gas, and diarrhea, which certainly makes irritable bowel worse. That would include things such as fructose, which is found in honey, and high fructose syrup in certain fruits, as well as lactose, which is in dairy, galactans, which are in beans, fructans, which are in wheat and onions and garlic, and polyols. Polyols. That's a name that you probably don't hear a lot, but that's the artificial sweetener that's in a lot of our foods, such as sorbitol and xylitol. And if you think about how many people chew sugarless gum, you can see why a lot of people may have symptoms.